Hi, my name is Dan Feeke. I'm your local STERIS surgical account manager, and today we're going to be in-servicing the 5095 surgical table that you recently purchased. We're going to start from the base and work our way up to the tabletop and then hand control. But right now I want to bring your attention to the weight capacity of the surgical table. We have the label here at the head end of the base that at 1,200 pounds on center is your weight capacity. Then if any articulation, we're going to be at 900 pounds. If the tabletop is slid and articulated, we're at 600 pounds. Also, if the table is in reverse orientation, it'll be 600 pounds as well. Make note, the 600 pound one is probably the one that is most important because you are going to most likely have this tabletop slid to the head or to the foot and articulated. So coming around to the foot end of the base, you'll also see this warning label that we ask you not to stack anything on the base of the table. We do have software built into this, but it's not going to know if there's anything on the base. You will cause damage to the base. You'll also see that we have added protection with shroud guard. That keeps everything away if you did have something on there, that it's not pushed up against the shrouds, potentially damaging those or damaging any internal components. All right, so now we're going to take a look at a few more features at the head end of the base. So first is the plug-in for your AC power. You'll need that to charge the table. Some customers like to leave their table plugged in. You don't have to. A good rule of thumb is plug it in on a Friday afternoon, come in, unplug it Monday morning. It's good to go. Generally, our batteries last up to 2 weeks. It all depends on usage throughout the week. Next, you'll see the grounding stud. So if you have any equipment in the operating room that requires a grounding, you can attach it right there. Moving over, you have your LCD battery readout. So you can see here we're fully charged. As the week goes on, you'll see that it may go down into the orange. That's just a reminder to plug in the table and charge it. All right, so now we'll come to the tabletop. It is a 4-section tabletop. You have your head section, back section, seat section, and leg section. Bring your attention to the tabletop pads. This is a Velcro-less tabletop pad, so infection prevention, easy to clean, no more cleaning Velcro. Next, we'll go to the standard side rail. You can see this is a smooth side rail. There's no mounting hardware for bioburden to get caught up in, easy to clean. Now I want to talk about the STERIS headrest. This is a dual articulating headrest. You have 2 levers on the bottom of this. The right lever is going to adjust the tilt, which you're used to. On the left lever, if you pull and hold, it's going to adjust the height. The benefit of this is for anesthesiologists for better airway access, for intubation, also for lateral patient positioning. You don't have to use multiple pillows. To bring the headrest back to level, press and hold the left lever with your hand on top of the pad and push it back to level. And then you're going to press and hold the right tilt lever back to level. Moving on to the leg section, this is a detachable leg section. By pressing and holding the levers, you can detach it here. To place the receptacles back in, I always come in at an angle, make sure it's lined up, bring it on. You have 2 cues that it is locked in place. You heard the audio sound of it actually clicking into place. And then you actually have the green and yellow lines here. If it's lined up with green, it is locked in place. I usually give it a little tug as well to make sure it is locked. All right, now we're going to talk about the hand control. Several benefits of this hand control is that this has a removable cord. So if the cord were ever to get damaged, severed, you can remove it from the hand control and just replace the cord itself. Second, we have color-coded buttons. This is for anesthesiologists' quick recognition of articulations they're looking for. Third, we have the LCD readout. So you can see that you're on battery power, your table's on center, and your table is currently unlocked. First, before any articulation is done, we need to lock the table. Going down to the floor lock, you'll press and hold this for 1 second. You can hear that the locks are engaging, and as the table locks, that color goes from orange to green light, and you also see the indicator that the surgical table is now locked and ready to articulate. Now we're going to talk about the tabletop slide. So you have 9 inches of slide up towards the patient head, 9 inches of slide towards the patient foot. What that means is you have 43 inches of total upper body imaging and 40 inches of lower body imaging. You can see on the readout how far you've slid the table either to the head or to the foot. As you see, as we slide it to the foot, you'll notice that you have the readout, but you also have the slight pause, and that's indicating that the tabletop is on center. Next is the height up, height down. The STERIS 5095 is the lowest height table that STERIS offers at 22.8 inches. This is great for minimally invasive surgeries. Then we have back up, back down, leg up, leg down, trend, reverse trend, tilt left, tilt right, flex, reflex, and then you have a power kidney lift that goes up 4 inches. While we're on the LCD screen, let me pause for a second and talk about another important feature of the STERIS 5095 surgical table. It's our ALS, or auto limit sensor. It is a collision prevention software that's built into the 5095 surgical table. So it's going to know its articulation in relevance to the base of the table, the floor, but it's not going to know if you have a kick bucket or a bear hugger underneath it. So let me show you how this feature works. What we're going to do is lower the leg section, and then we're going to slide the table up towards the head. You notice here that the table stopped. It's preventing itself from colliding into it. And you can see on the remote that we have the ALS icon, and it's also showing us how to get out of this collision potential. So we put the leg up, and now we can continue with our slide towards the head. Below the articulation buttons, you'll find the patient orientation. You can see here that we are currently in normal orientation, denoted by the green LED light. If you want to put the patient into reverse orientation, press and hold the button for 2 seconds. You can see that it went from the green LED to an orange LED to denote that we are in reverse orientation. The next button to the right is that floor lock or unlock. We showed you how to previously lock it. Now we're going to show you how to unlock. You press and hold for 3 seconds, and that is going to start unlocking the table from the floor. And you can see now that the orange LED light is lit up, along with the LCD indicator that it's unlocked. On the bottom left, we have the return to level. That is going to return the table to level. If you have it articulated with the patient on there, it's going to ergonomically bring that patient safely back to level. On the bottom right, we have the stop button. If you press this, it turns off the remote. To turn the remote back on, you hit any of the buttons, and it automatically turns back on. All right, next we're going to talk about the backup hand control. If your primary hand control were damaged, you do have a backup hand control. At the base of the table, there's a drawer. You pull it out of the drawer, you will notice that you have similar articulations. This allows you to get that patient back to level orientation and off of the surgical table. If you have full power loss of the table, you will use the foot pedal found on the base of the table in conjunction with the backup hand control. You will press the articulation that you want while pumping the foot pedal to get the patient back to level and safely off of the surgical table. Note, in full power loss, the tabletop slide feature is not accessible through the backup hand control.